that. And like I say, having been on those sort of committees and bodies that investigate those, it's really taken super seriously. You know, it's not swept under the carpet because it's important for the patients, but also reflects on all of us. And I think it's important that that doesn't happen. And it really is taken very seriously.
Bill Kelly from Coonabarabran. Coonabarabran Hospital, of course, is my keen point of interest as far as doctors are concerned in particular, and of course nursing staff. I'll cut it very short. The Warramugga Medical Centre have done a lot in the past, training, in getting involved with the trainee doctors, visiting Coonabarabran and coming there from time to time over several years past, which I believe is a good idea. One day, one or some of those might come back and be a local doctor at Coonabarabran. But we really need to try and apprehend the impression I have in particular, and the impression of quite a few people I've spoken to. The place is gradually being closed down, and that's not what we want. You're not going to encourage people to work there, whether it be nurses or doctors, if it looks like it's in a dying situation. And that is the impression that comes back by talking to some people who've been in the place of late.
Thank you. Who'd like to take that?
There's one other point I would like to raise, and seeing the time is as it is,
yes,
I'll get out of the way.
Yeah. One more question and then we'll finish.
How long do we have to put up with the threat of insurance as a deterrent to having clinicians, etc., working for us? They killed off all the obstetrical nurses very quickly a few years ago, probably started 10 or 12 years ago, by the threat of being sued in case something happens when you're delivering a baby. Admittedly, some changes had to take place, and modern medicine have religious to the need of lots of operations that used to take place at Coonabarabran. But there's still a bit of a time, I believe, for some kind of a turnaround that needs looking at. Okay. Thank you very much.
Who would like to take Robin or?
Yeah, thanks, Bill. Yeah, I'm very passionate that smaller facilities do find a role. I've certainly have no interest in seeing a diminution in the services that they provide. And I think that that's something that we've got front and centre in part of our ethos, because without facilities being maintained in small towns, then the trickle-on effect is horrendous for their communities. So that's not something that I would hope would happen, and I certainly think that as we go into our clinical services planning and looking at all the facilities, we'll be looking at roles for facilities like Coonabarabran. I've said to many health ministers prior to meeting the present one that I wouldn't work in a small town if there wasn't a facility to look after patients in, because I might as well be a GP in Leichhardt, and I didn't emigrate from Wales in order to be another GP. The real reason we came to Australia, apart from the fact that we felt it was a better place to bring up our children, was that in Wales I was working as a just like a suburban general practitioner, referring everything to large hospitals and not doing as much clinical work, the real hands-on stuff that I wanted to do. And that's what is the great attraction of getting people to come and work in smaller towns. What we've got to try and do is make sure that the new cohort of doctors coming through realise how good it is to be doctors and nurses in communities like this. And that again comes back to workforce planning and what we can do about it.
Thank you very much for that. Point is, of course, you particularly, if you were living in Sydney, would appreciate the fact if you've got somebody that's a bit sticky, send them to the local accident and emergency department and you're finished.
Yeah.
And there's at least one I know of pretty close to Coonabarabran doing just that. But we have to try and give proper service to the community, if it is at all possible, rather than have to traipse. And some of the elderly people, and my age group's in that, but I'm still lucky to travel. but it costs a lot of money to travel long distances to see a doctor. And
Well, I
we've
agree.
got to avoid that situation happening.
Sure, I
We
think
need
we've got
to
to
keep some there.
Yeah, we've got to agree, I think, to try and make the hospitals places that the new clinicians want to work in.
Yep.
And I agree with you, that means that the facilities have got to be maintained and enhanced wherever possible. The other issue that I forgot to address was the insurance issue. I think by and large that has been addressed now by the Treasury Managed Fund. There was a huge problem with insurance with proceduralists and obstetrics. That was in the time of Craig Knowles as Minister, so we've had about four, five, I think, since then. So that has been addressed, and again, it did cause a big problem with regards to putting a lot of the newer doctors off training to be GP obstetricians, and I'm very glad that the present government is very committed to enhancing the training of GP proceduralists so that we've got the people on the ground to provide the service, and then we can perhaps look at enhancing the provision of services into smaller towns.
Thank you, Mr. Chairman. One and all involved.